right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So, what is on our agenda for today, Heather?
This week, I'm super excited to chat with Isabel Stewart. She's the head of product for Guava Health and also a founding team member of Guava Health. Guava is dedicated to building tools that empower people to take control of their health. A graduate of the University of Vermont with a degree in molecular genetics, Isabel spent time in wet labs at the University of Vermont as well as the Jackson Laboratory in Bahaba, Maine.
Bahaba.
How'd I do?
You said that pretty well.
Thank you.
I could tell you're not native, but better than most would do with it, with the Bahaba.
So Isabel then joined Amazon Alexa, where she worked on the health vertical as a knowledge engineer, working with large data sets to deliver answers to critical health questions, from medication side effects to pandemic updates. I realized as soon as I said Amazon Alexa that I looked around to make sure I didn't have one of my Alexas in here because she might have asked us a question.
Yeah. There you go.
During COVID-19, Isabel spearheaded Alexa's information response, ensuring users globally had timely and accurate information about symptoms, local case counts, and more.
So, this is one of the people behind Alexa.
Yeah.
Oh, that's wild.
Yeah, really cool. So at Guava Health, Isabel combines her passion for health and technology, working closely with end users who are patients to create solutions that improve health management and quality of life. So another total rock star on our show again. So
Let's go. It's one genius after another on here.
Yep, pretty much.
It's like a Mensa convention in here. I don't know what I'm doing here. I just own some microphones.
Yeah, that's basically it.
All right. Well, without further ado, let's get into it. Here is Isabel from Guava.
Hi, Isabel. Thanks and welcome to Healthcare Uprising podcast. We're excited to have you on the show today.
I'm excited to be here. Thank you.
Great. Well, let's jump right into it and tell us a little bit about your background, your experience, what drove you to join and help build Guava Health and and really kind of what your story is and what you're here to do.
Sure. I'm Isabel. I'm head of product at Guava. My background is actually in molecular genetics and microbiology. And I spent a lot of time in wet lab research, which is hanging out with mice a lot of the time. And after a little while, I realized that I enjoyed human interaction a little bit too much to make a career out of that. So I switched over to tech and engineering world. I joined Amazon right after college and the pandemic hit. And because of my background in health prior to that, I was on the health vertical for Amazon Alexa. So during the pandemic, I ended up running a lot of Alexa's responses. So I worked with Reuters, I worked with AP, I worked with Hopkins to deliver as up-to-date information as possible on the pandemic. And that was a really eye-opening experience and kind of got me more inundated into the health ecosystem. And after that phase of my career passed, I ended up connecting with the co-founders of Guava, who had also worked with me at Amazon. And they told me about this really cool project and startup that they were working on. I was like, oh my gosh, how do I join? Like, you are working on this really amazing thing that can help so many people. And you guys have such a great tech background, and I would love to be a part of it in any way that looks like. So that's kind of how I ended up joining Guava. And a few months after that, it was early days Guava, and I was doing a lot of early interviews for people's personal experiences navigating the healthcare space, because really what Guava was at that point was we were building a foundation for solving an information problem. So we were building out integrations with the VA or Centers for Medicare and Medicaid, MyChart, Cerner, Epic, et cetera. And so one of the people that I chatted with was someone I had gone to high school with, Emily, who now works at Guava as well. And she had posted on social media about how she had chronic Lyme and 3 tick-borne illnesses and toxic mold poisoning, and how it was only through the fact that she had the accessibility and the funds to be able to go out of network for these providers that she was able to get a diagnosis. And that was a really impactful conversation, I would say, and kind of switched my thinking about what guava could be. And so we really took that back to the team and said, hey, like there's this absolute need in this chronic condition space of people who are spending 10 years to get a diagnosis and don't know where all of their records live. And so let's really try to focus on solving these really hard problems about integrating all this information into one place and see what we can build out to try to improve the quality of life for people who have these chronic conditions, whether they're diagnosed or trying to get a diagnosis.
Wow.
Yeah.
Yeah, sorry,
That's
this was a long monologue.
no, that's amazing. I know a little bit about guava, and so that's a great setup, I think, for kind of understanding maybe the impetus behind Guava Health and how it came to be, and the fact that you were working in a lab with mice, and then you end up working in the healthcare vertical of Amazon Alexa. So, like when I ask a question, hey, as we like to call Dr. Google, right? Um,
Mhm.
why does I don't know. Why is why do I have a headache when I do XYZ? Like you're gonna like you were that's a really dumb, probably lame example, but um do you come up with the prompt or the responses on that? Is that what you were doing there?
Yeah, so
Oh wow.
we worked with structured data sets for the most part. I was a knowledge
Uh,
engineer, which means
okay.
absolutely nothing to most people. But it basically means that I dealt with structured data sets and worked within a knowledge graph. And so when you asked Alexa a question like, why do I get headaches? Or is a headache a side effect of Zoloft? That is something that Alexa understands as a prompt or a question where it's like, does X cause Y, or is X a side effect of Y? That gets fed into the system, and then I will have worked something on the back end, or another version of me work something on the back end to surface the hopefully correct answer from a reputable source, because that's really important because we don't want to be serving inaccurate information.
So you've worked in labs, you did that. Obviously, you're learning a great deal of knowledge about very clinical things, I
Mhm.
imagine, in that. And then you come to Guava, and I want you to tell us a little bit more about what actually Guava does. But I do want to kind of circle back at some point. Oh my God, I just dropped corporate jargon. I am going to apologize for that immediately.
There
Rewind,
is no place for that here.
rewind. If only, make sure you add in the rewind sound, Jeremy, on that one.
Here you go.
Perfect.
Gone.
I do want to come back to that though, because how that has made you so qualified and knowledgeable in kind of Guava Health's objectives, right? Like the ultimate goal, having that kind of knowledge because medical conditions are complex. So let's talk about next. Just tell us really what is Guava Health doing? Like tell us about the app, kind of the
Yeah.
purpose, the goals, everything.
Yeah, so Guava does a lot. It at its core is solving an information problem. So in the US, at least, all of the different patient portals that you have are likely completely separate things. So the information that exists on the patient portal that you see in Hospital A is completely separate information from what you see on the patient portal in Hospital B and Hospital C and Hospital D. And people have this conception in their head that all of their providers have access to this information and all they have to do is look up your name in this massive database, and that database does not exist in the US. It should, and it doesn't. There are some countries who are better at it than we are. But because of that, it's really up to the individual patient or person to make sure that their providers are informed and have all of this information. And if you're a really healthy individual, then it kind of matters a lot less at that particular moment in time that provider A and provider B have that same level of information on you. But if you're trying to get a diagnosis, or if you are trying multiple different types of meds that have been prescribed from different providers, then it matters a lot more. And so Guava helps you integrate and keep those integrations live with connections to your patient portal at Hospital A and your patient portal at Hospital B, and then your fitness devices and your medical devices like Dexcom and Libre, and allows you to track your symptoms and set med reminders and track your cycle. And all of that information because you are a whole person. It's not just the clinical data. It's not just the fitness data. It's not just the symptoms. It's like all of this packaged into one singular place. And then with that, you're able to, one, understand more about your own health, and then two, help your providers help you at the end of the day because they have the information in a way that they can understand really quickly as well. And so that's kind of the core problem I would say that Guava is solving because we've moved on a little bit from the foundations and we're able to kind of dive a little bit deeper into what we can do now that we have this data so we can help you discover insights like, is air pressure actually affecting your headaches? Or is that, I don't know, spaghetti and meatballs that you eat every Friday impacting your stomach aches on Saturday morning? And so we've really kind of migrated into more of empowering the individual to get answers and to understand their health more.
It seems to be a now recurring theme on a lot of our subject matter here that healthcare in America is going towards a point where people have to start figuring it out for themselves and then let their doctor know what's wrong.
Yeah.
At-home testing, we've done some at-home testing stuff, and with these apps that are tracking things for everybody and like figuring out their problems. It's almost like a bittersweet thing. It's very cool that we're starting to have the technology. It's very Star Trek. You can hold your doctor in your hand and it can tell you what's wrong. But at the same time, what does it say about our actual healthcare system and our interaction with our doctors and the whole process and, the actual IRL healthcare process? That's the bitter part, I guess.
Yeah. I have so many thoughts on our healthcare system.
Yeah.
Uh, I
We do too.
yeah. I mean, you guys are doing this podcast for a reason.
Exactly.
Um, I think it's both a wonderful thing that we are giving more power to individuals, not just Guava, obviously, but as you mentioned, at-home health testing kits as well. And there's other services that are really trying to upend the current status quo to make life better for individuals. But it is really frustrating, just all of the red tape and all of the bureaucracy within the healthcare system to make change. Uh, and so it's really, we have to collectively, and I think we're not the only ones who realize this, like we have to work from the patient forward rather than trying the health system first. Because when it goes into the health system, they're already inundated with so many things that they have to do. Like providers get to spend 12 minutes of their 30-minute appointment actually talking with a patient, and the rest of it is charting or making sure that all of the notes are sent over for the referrals or whatever it is. And so it's been a really interesting process working patient first rather than trying to change things within the healthcare ecosystem first and hoping
Yeah.
that has a trickle down effect.
The system
Makes sense.
itself, I mean, I've always, and I come from the carrier side. I
Mhm.
did anyway. I worked in that space for a long time. And I always described it as it was like turning the Titanic, right? Like it's so big, it's so clunky, it's so complex. There's a bazillion things going on, right? So many different things that are happening that kind of bubble up to the top there that the patient has kind of gotten a little bit forgotten, excuse me, a little bit forgotten in the process, right? So,
Yeah.
but I love the way that I love the way that the industry, quote unquote, is shifting to become more consumer friendly. Which I've never, I've worked in the healthcare industry since 2002, and so to see that change and to give people power and empowerment in decision
Yeah.
making around their healthcare is a pretty beautiful thing to see. And digital technology, AI is really, I think, the catalyst for that. So,
Yeah.
and people getting sick and tired, quite honestly.
Yeah. I think AI will hopefully be a huge relief for the strains on the system, because AI can kind of be the first line of defense for people trying to find answers. And so they don't have to go to the ER or urgent care or try to schedule an appointment that will cost them $60, $100 for 5 minutes of a provider's time, and instead can utilize AI to get some answers. And then they can take that initial research to talk with a person. I don't think we'll ever lose that human connectedness within the provider ecosystem, but I do think that there is so much good that AI can do. And it's been really fascinating kind of looking at the different perspectives, whether you're on the patient side and what AI means for you versus if you're on the provider side or the administration side, and what AI means for them and what AI means in like a hospital setting. So it's a really exciting time, and I'm really excited to see what the world looks like, honestly, in a year from now or 2 years from now.
Yeah, me too. It is. I tell everybody to work in healthcare right now is maybe the most exciting time that at least I can remember. Again, I've been around the block for a while, but I love being a part of it so much that I don't want to leave because um, we're part of the uprising.
Yeah.
Right? I mean, we are. That's what this podcast is about, is talk with folks like you and what you're doing. And Jeremy, did you have a question? I'll let you plug in
Actually,
here.
just wanted to say, as someone who's not in the healthcare industry, I am glad to hear this much positivity coming from two people who are
Hmm.
right now,
Yeah,
at least in this capacity.
I
And
think,
and the
yeah.
fact that this technology is going to give people the ability to kind of take control of their own healthcare and understand their own health in a way that we've never been able to do before.
Hmm.
That is pretty exciting. It's exciting.
Yeah.
So let's talk a little bit more about Guava Health too, in terms of what, this app, and the capabilities that it has, which is really pulling together a lot of information in somebody's medical record into one place, right? And then kind of seeing some cause and effect things, right? Like if I do this, I'm seeing my blood pressure go up if, they're tracking that way. Are there certain people or people with certain types of illnesses or conditions that the app is really well suited for? Does it make sense? Does it make sense for somebody who's really well to use it? I mean, maybe it's more of like preventive care, right? So I guess I don't know. Let's maybe talk through that a little bit.
Yeah. So Guava is ideally built for everyone. My parents who are in their 70s use it. I definitely will help them here and there with like what button to press, but they're capable and competent enough to be able to navigate the app pretty much on their own. And then we also have functionality and features for new parents for their kids, and so it really is a whole family experience. I would say that for right now, the people who find the most value, it seems like just based on people reaching out to us, are people who are navigating the healthcare system a lot. And that usually means that they have more than one chronic condition, and they're seeing 5, 10, 15, 30 different providers within a 6 month period or a year period. And so they have a lot of information that is really challenging for them to keep track of. And they have all of these symptoms that they're experiencing. And when you're sitting in front of a provider and they're doing the rapid fire questions of how many headaches have you had this week, or what's the severity, or what's the frequency, and you get nervous and you black out, then you have to kind of repeat that exact same experience 5 times over to finally get an answer. And so Guava has really kind of bridged that communication gap for a lot of people where that data just exists. And we've put it into a format that both a user like you and I can use, and also a provider can look at it and immediately understand the relevant information that can allow them to give the best care possible. So it is technically a whole family app, but in practice, it's definitely people who have chronic conditions who have found the most value out of it.
That makes sense. And I know you mentioned my chart, which I think obviously plays a big role in terms of bringing in medical records. And if someone's seeing 15 doctors, oh my gosh, that's crazy. In one
Yeah.
year, it's like mind blowing. I've never had any like long-term chronic conditions or anything like that. So I know people who have, but Can can you talk about and maybe explain a little bit more about how my chart plays into this in terms of the medical records? So like I can go into the office and be like, "Hey, I've got everything I need to know from every visit that I have." Like, how does that work?
Yeah, so the way that Guava works with my chart is that my chart is a patient portal, and my chart accounts for, I want to say, 50 to 60% of patient portals across the US. So they are definitely one of the biggest, if not the biggest player. Cerner is another heavy hitter. But what that really means is that all of the hospitals that use my chart, uh, all still have separate my charts, and they've gotten better. And so now they have, I think it's called Care Everywhere or the Epic Orchard, and providers are able to see records from across other my chart accounts for you, but they still don't have access to your information that exists in Cerner or Hilo or Allscripts or your device data. And so Guava allows for that integration of not just the MyChart information, but also all of the other patient portals that you have and your medical and fitness devices. And something that we've heard too that has actually been really eye-opening, because similar to you, I don't have 15 separate doctors that I see. I have, I want to say five or six. But I'm pretty like I know kind of what's wrong with me. And so when I look at my condition list, I'm like, oh yeah, this makes sense. Or my active med list, I'm like, oh yeah, like I'm actively taking all of those. But when people who have all of these different providers who exist in different systems, and patient portals aren't built for the patient, right? Like they were originally built for billing, and a lot of people don't know that. And so the actual user experience for this is really challenging for patients to navigate. And so they found that with Guava, the way that we're structuring the information for them, they have found conditions that they didn't even realize they had a diagnosis for. And it was diagnosed from a provider that they saw 5 years ago. And it was a diagnosis that they were actually spending a lot of money to get a diagnosis for currently. And that is not an uncommon thing that people have mentioned. Or they've talked about meds that they've tried and they can't remember the name. And so a provider will be like, oh, try this med, and it's something that they've already tried before. And so using Guava is actually a way for that information to be shared with their current providers because it exists in a siloed system that those providers don't currently have.
So hold on. I don't know if you saw my face, but it was like, wow, pick my jaw up off the ground.
Yeah.
Legitimately, people are finding out
Yeah.
by using Guava when medical records are then loaded into this app and they're reading them that
Hmm.
they were diagnosed with conditions but not told
Yes.
about it.
Hmm. I've
How?
had
Wow.
I've had like a couple dozen people reach out in the past few months, mentioning kind of in that same vein, like, oh, I've been trying to get a diagnosis for this thing and no one believes me. And it turns out that it was an actual diagnosis from a doctor that they had seen years prior, but that information didn't exist in the current healthcare system that they were in because they had moved. And
Like it
so the
didn't
doctors
carry over, essentially.
Exactly.
Okay.
Yeah, because they existed in different systems.
Hmm.
And so you pretty much kind of start fresh. Like when you see a new provider, it's kind of whatever information you give them in that first 20 to 30-minute appointment, and then everything moving forward. And it, like nothing from before kind of carries over unless you tell them. But if you
Right.
don't know you have that diagnosis, then it doesn't exist to that new provider.
I, this has been one of the big problems in healthcare, right? Is the information pathways where like no places don't share patient info properly and different doctors don't know what's going on with the patient. It sounds like you guys solved that. You actually found one spot that can get all the information together so you can get an actual clear picture of what's going on with the patient. Like
Yeah.
that's a huge step forward, isn't it? Like I know I'm not the healthcare guy here, but
No, that's a big
I mean that's
deal.
a big problem they've been trying to solve for a long time. It sounds like you solved it.
Yeah, well, we're definitely trying our best. A lot of it still is definitely patient driven. So the hospital institutions right now can't do it themselves. It still requires an individual to be like, yeah, I want to pull my records from patient portal A and patient portal B and patient portal C. But once it exists in Guava, it's continuously updating. And so if you go see a provider at any of those institutions, information will automatically be added into the Guava ecosystem. And if you share that with your provider, then they will have the up-to-date information on you, which is why people who have all these conditions really love it because it means that they can spend less time monologuing or trying to articulate what's going on. And it's just like, here's the data, here are my questions, and here's what I'm hoping to get out of this appointment.
Can I ask, like, what are the main problems? Do you know? I don't know if you even have stats on this, but like, what kind of chronic conditions are the most popular users of your app of Guava? Do you have stats on that? Like, what elements are the most tracked or anything like that?
Yeah, so we have a lot of people who have Ehlers-Danlos syndrome, POTS, and I don't know if you've heard of these conditions. They're on the more rare side, and they tend to affect women between the ages of, I want to say, 16 and 35, 40. Uh, and I think that kind of just is in line with where our audience is, or our user base is. It tends to skew female, and part of that I think is just they see myself or they see Emily on social media and they're like, oh, another female. And I think a larger part of that is that females tend to have a lower diagnosis rate, and it takes them longer to get a diagnosis, and they have those more rare or underfunded or under-researched conditions. And so it's really, I don't want to call out providers because I do truly love providers, and a lot of them do a world of good. But historically, with our user base, like, so many of them have felt gaslit, and so many of them have just been absolutely ping-ponged throughout the system of like, it's probably anxiety, or it's probably in your head, or it's probably your anxiety or your bipolar disorder that is causing you to think that you have this physical ailment. When in reality, like, both things can be true. You can have anxiety or another mental health condition, and you can also have this other physical condition. And so that tends to be where our user base seems to be. It's like younger females who need this resource to be taken seriously when navigating the healthcare space.
Yeah.
So it's almost like the rare conditions, you need it more because it's so much easier for them to slip through the cracks.
Yeah.
Is what I got from that.
Mhm. Or be misdiagnosed or underdiagnosed or not
Yeah.
diagnosed.
Yeah, I mean, so many
Man,
people, they'll go through like three or four different, and I didn't know that this was a thing, but like, so many people will go through multiple diagnoses before actually getting to the diagnosis that is what's causing their slew of symptoms.
Right.
And I kind of had this assumption just based on my own really lucky care, where if a provider's like, this is what you have, or this is what I think you have, that's what I have. And in reality, that's not necessarily true. Like, people will go walking around with a diagnosis that, to your point, is a misdiagnosis for years, and it will take them
Mhm.
even longer to get the accurate diagnosis and then get onto a track of getting a treatment or a therapy that's actually going to be effective for them.
And I mean, I have to imagine too, and I'd love to hear kind of the feedback on this. And also just a quick plug, we're going to be meeting with Dr. Kat McGraw from Guava Health, your new chief medical officer, in a separate episode where we'll get a lot more into the clinical pieces and, her perspective. But I have to imagine the providers who have the patients who are using Guava and they're coming in and they're like, hey, it's like all right here. Um, they've got to be grateful, right? Because they're limited in time, right? It's not, providers or doctors want a doctor, right?
Yeah.
Most do, right?
Yeah.
And unfortunately, the system itself has made it more and more harder for them to do that. And so I have to imagine, just like the limited amount of time that they have with their patients. So I have to imagine that this app and the information and the capabilities it has makes things better for them too. Like, what kind of feedback have you gotten on that
Yeah.
part?
It's been really interesting. So one of the first projects that I worked with Dr. McGraw, who is an awesome individual, she's great, was the visit prep experience. And the reason for that was because she came from the provider perspective, and I already had a pretty good glean of what was going on or what was wrong from the patient perspective. And I guess I can go into a little bit of background of this, but I had lunch with a man whose 6-year-old daughter had a brain tumor, and he knew that something was wrong and went to provider after provider after provider for this 6-year-old. And all of them were like, oh, it's fine that she's clumsy. That's a normal 6-year-old behavior. Oh, it's fine that she's falling down the stairs or that she's forgetting words. Like, she's 6. It's normal. And it took him talking to one of her teachers who said, I exist with 5 and 6-year-olds every day, all day for the past 15 years. Like, what your child is experiencing, that's not normal. And so when you go to a provider, you should say these specific words and tell them that their teacher noticed something was wrong. And so it took this third party individual to basically tell him what to say to a provider for a provider to take him seriously enough to then go get an MRI. Once they got the MRI, she had a tumor the size of a clementine, and then it was like, care kind of just unraveled from there, in a good way. Like he was finally taken seriously, obviously, but it was immediate. Like she was helicoptered to the tier one hospital. But from that conversation and talking with Kat, there's clearly a breakdown of information sharing between the patient who thinks that they're doing a really great job of telling the provider what's wrong. And the provider is looking for very specific keywords. They're looking for things like dull, ache, burning, radiating when you're trying to describe your pain. And even though those are common words in our dictionary, it's not necessarily a common word for you to describe how you're feeling. And so the visit prep was created with that in mind to bridge that information gap of like, okay, here's the symptom that you're experiencing. With these default adjectives, how would you describe it? And what is the severity? And then if you've been logging for 2 weeks worth of time, you can create a visit prep and it's delivered in a way that is 1 to 2 pages long. And the providers really love that because we're not the first tracking app on the scene, right? Like there are so many other symptom trackers out there or med trackers. And for them, they're overwhelmed with information. Like they can spend hours scrolling to find a needle in the haystack in their My Chart, or a CSV file. Like they don't want to look at that. And so the visit prep was built with Dr. McGraw in a way that providers are like, oh, I can immediately see what's wrong with you. Like, thank you so much for giving me exactly what I needed. And now we can just spend time talking because it's built in a way that they are already familiar with from med school training and charting. And so it allows the patient to actually feel heard and the provider to have the information that is going to help them because it's like, okay, the headache is described as dull and it's this severity and it's this frequency. And here are the meds that this person has tried. And here is the relevant active conditions or active meds that are on their list.
That's great to hear.
Yeah.
That's good stuff. As you were talking, I was thinking a little bit more too about, and you've already shared a little bit, I think, touching on how this app has made people's lives a little bit more manageable, particularly those with chronic conditions. I hadn't thought about it. You had mentioned, like a parent managing their kids, especially when they're younger, vaccines and all that kind of stuff, or, whatever else is going on. But in terms of like, I don't know, outcomes, trends, like what are you seeing that is exciting and amazing or even surprising for that matter for like your users? Maybe that's through member testimonials, maybe that's just through data that you guys are collecting.
I would say something that I personally love seeing is when people are utilizing the visit prep experience. That's obviously a feature and functionality close to my heart, but it's been really amazing when people will email us or Instagram DM us or TikTok DM us and be like, hey, I used the visit prep experience, and for the first time ever, I actually feel validated by my provider and not just brushed off or not just like, oh, you seem like a complicated case. I'm going to push you off to the next person. And that has been amazing to see because it does really, it takes one good conversation with the provider to completely change the trajectory of someone's healthcare experience, right? Like that's all it takes. And I think that providers kind of forget that and they sometimes feel like they are just another cog in the machine. And so being able to help facilitate a good conversation to make one person's life easier is really amazing for me personally. Something that's surprising, I would say, is we recently launched something called the Insights Hub. So it's a public page. You can go check it out, but it's where people are sharing their statistically significant correlations that they discovered through Guava. And so it's the, higher air pressure and increased headaches or eating dairy and stomach aches. And so it's been really fun to see all of these different people sharing those stat sig correlations, and they can tag conditions that they have that they think might be related. And so I'll go on to the Ehlers-Danlos page, not the EDS page, the Ehlers-Danlos page, and scroll through and see what are common correlations that people are sharing within that group that seem to be patterns. And that's really exciting because, again, it's an under-researched condition. And so it's really putting power into patients or consumers or users to get answers or to find answers just through the power of the population and the power of the people.
That's amazing. It's like this could potentially discover the causality of things that we don't even really know have a direct cause, like dietarily or something like you eat these two things together, it's going to cause this problem. This
Yeah.
might actually like discover new things to avoid and like, wow,
And
Yeah.
that's
can you
kind of
repeat?
mind-boggling.
Yeah, can you repeat where that is, what that is again? The
The
website or
Insights
webpage?
Hub,
Insides.
Insights, like
Oh,
I and
Insights Hub.
yeah,
Insights.
Gotcha. Okay.
Gotcha.
yeah, yeah.
And
The
that's
Insights.
is that part of the Guava Health kind of online
Yeah.
ecosystem? So
So
you have to be a member or user of Guava to access that?
no, so it's actually public.
Oh, it is public. Okay.
Yeah, and it's based on people. It's only what people have said that they want to share. So I have correlations that I'm like, I don't, this doesn't seem like it would help anyone else. So I'm just gonna keep it to myself. Or I'm not comfortable sharing it or whatever it is. And then I've probably shared 50 or 60 correlations at this point, and other people have done the same. And so it's a public page, and we're organizing it right now based on conditions. So EDS or POTS or endometriosis or PCOS or long COVID. And then people can kind of sift through those correlations where it's like common symptoms that people are sharing or common therapies that people are trying out and seeing whether or not it has a positive or negative effect on their own joint pain. And within the Guava ecosystem, Guava will surface what we think are relevant correlations to you based on your own information and based on the conditions that you have and based on correlations that you have. And so that is unique to being a Guava user.
Hmm.
And Guava right now, if we can talk about kind of how it's, accessible, is it pretty much like a direct to consumer app at this point? And is that the plan to really just kind of remain that way, or is there any plans to look into like Medicare, Medicaid, employer benefit plans, things like that?
Yeah. I mean, I think it would be awesome to partner with organizations. For us, something that is really important to the founding team as a whole and just generally everyone on the team is that we make sure that our incentives are always aligned with the end user. And the end user is us. It's people. It is not a healthcare institution. It's not a healthcare administrator. It is not a provider. We would love if, as a secondary consequence of Guava, we do make the provider's life easier, or we make it easier to navigate the healthcare system, regardless of who you are within that system. But it's really important to us that our business model aligns with the end user rather than just a B2B business exchange.
Yeah. No, and healthcare is human, right? So,
Well, it's a
Exactly.
power to the
Yeah.
people thing. That's
yep.
that's what the uprising's all about, right?
Yeah,
That's why
we like
we're
it.
here. Bringing it
Very,
to the people, man.
very, very aligned. And now
Now they're barking.
the dogs are the
If it
dogs are
makes you feel any better,
barking.
I can't hear anything.
Oh, good.
Okay, just go ahead.
I'm just going to keep going. So you mentioned the Insights Hub. Obviously, making providers' lives easier is a big goal. Are there any other like big changes coming, like in terms of, I don't know, product changes or anything like that that you can talk about or that are in development even?
Um, I would say the Insights Hub is a big one. I would say in 2025, we do want to kind of focus on the provider experience a little bit more. And that has come because a lot of the providers that we work with are patients themselves, because we're in the rare condition space. So that has kind of been a happy accident for us, not so happy, or I guess a coincidence would be a better word of it than anything else. And so we want to make it so that people who are providing care and who are doctors or who are nurses in these more rare condition spaces have an easier time getting the information that they need to deliver care fast. I went to the Ehlers-Danlos Society conference in July, and there are I can count on one hand how many EDS specialists there are in the state of Wisconsin. And one of them was a speaker at this conference, and he has a wait list of 4 years, which is insane. 4 years just to see him. And so if we can help expedite his efforts and his care by helping patients come prepared for everything that he is looking for, then that would be great. And so that's something that I'm looking forward to in 2025. We're always looking to improve the correlations experience, something that we're actively working on and have launched but are going to continue improving is the Guava Assistant. And that's kind of where AI is used within the Guava ecosystem. And so you can ask questions to the Guava Assistant around your own health information. So for me, it's like I'll have a headache and I'll ask it, is there anything in my active med list that could possibly be a trigger for my headaches? Or how many back pain spasms have I had in the past month? Or what was the last time that I had my blood pressure read and what was the number of it? So it's really getting personalized information insights based on your own information and what you've put into the Guava ecosystem.
So today, the Guava app exists. Anyone can go online, right? Any of us humans out there,
Yep.
and sign up. And I understand there's a free version, and then there's you can like many things, right? And then you upgrade and get the paid version, which is probably more suitable for people with like very chronic conditions. So that's how it works today, right? So like you just go on, enroll, or whatever that process is. Like what can you talk just a little bit about that too?
Yeah, so you can find us on App Store, Google Play Store. You can find us online. One thing that was really important for the co-founders was that we were accessible on pretty much any device. So you can use us on a tablet, you can use us on a phone, on a computer. We're web-based, so you don't have to have the app. Like I can go on guavahealth.com and sign in and be on my laptop and it worked just as well. And then the other thing that we're doing a little bit more of is partnering with providers, and really what that looks like. It's pretty much the same experience from the patient perspective. It's just navigating or finding out about us through providers and making it so the provider has an easier time getting the information that is most relevant for you in your care. Because something, and feel free to cut this out, but something that was really interesting learning from Kat is that when you are a hospitalist or someone just working in a hospital setting, you are manually scrolling through pages and pages and pages worth of data to find a needle in a haystack, and you already know the needle. And it takes hours of your day, every day, to search for that needle for a single patient. And so with Guava, you can literally just type into the search bar of that particular patient's profile and find exactly what you're looking for immediately. And so that's something that we want to work more with providers with, because we're making their life easier to make the patient's life easier. So first and foremost, app stores, website, social media, and then secondary to that would be through providers.
It's like sticking a big old magnet in the haystack and pulling out the needle just like that. Just
Yeah. Oh my God, that's a perfect analogy. Yeah.
She's like, I'm going to use that.
you're the magnet
Yep.
in the haystack pulling out the needle. Feel
Yeah,
free to use it. Yes, you can have that one.
No copyright issues on that, Jeremy.
No, I give those away.
It's amazing. It's like you went into this, or obviously you're part of this. The founders saying we want to help the patients, right? We want to help the people, and it's becoming this tool to really help the providers too. So, I mean, it's pretty amazing. And what's more important than the patient-provider relationship in healthcare? So,
Yeah, I agree.
yeah, doctors can doctor more.
Exactly. And I think for so many patients too, because they have had bad experiences, they then don't trust their providers, even if it's a different provider at a different hospital system, or they feel like all providers are not going to listen to them. And from my perspective, like if you're a doctor, by and large, you're not in it for the sole purpose of making money, right? Like there are
Mhm.
so many other ways to make a lot of money that doesn't require so many years of school and so many long, long days and long hours. And so you're in it because you do want to help people. And it really is just trying to find a way for them to doctor, allowing doctors to doctor and allowing them to actually spend time with the patient and listen to them and make them feel heard, and solving their problems in how they were trained. Like they didn't go in it to chart, they went in it to help people.
Yeah, this is a game changer.
Yeah, and it builds confidence for the patient too. Like people walking in not knowing how to say what they want to say, it makes it very difficult. But with that, like your visit prep there you were talking about, that it actually gives them, the vocabulary, gives them the specific way to present what they want to say, that they walk in there with confidence and they say, "Doctor, this is what's wrong with me. This is why I know that." Yeah, and
Yeah.
it makes it such an easier, streamlined process for everyone involved, it seems like. What a great idea.
Yeah,
Yeah.
this is
It's
exciting.
it's so funny because the white coat syndrome is so real. And so I personally get severe anxiety going to a doctor, and I will have scheduled an appointment because something is wrong, and I will spend 19 of my 20 minutes being like, "Oh, I'm fine. Like, I don't even know why I made this appointment. Like, my symptoms aren't that bad." And then as they're walking out the door, it's like, "By the way, I have this one little thing that like could be problematic, but I'm sure it's fine." And the provider's like, "Okay, well, I have no more time with you today, so you're gonna have to schedule a follow-up." And that happens to so many people. And so this idea of one, feeling more confident because you have the data on hand. And two, if you're worried about a provider not believing you, it's not you saying these things from your memory. It's a piece of paper with data that exists. And it's like, here's the data. You have to take me seriously because it's not just me saying this. It is this other third party app that is saying this. And I think that that also is really validating for people too, because it's like, if you're trying to remember what you ate for lunch today, or if you're trying to remember how many headaches you've had in the past week, that is it. We're fallible, we're human, we don't have a great memory as it stands. And so having this piece of paper where it's like, oh, I can actually say definitively how many headaches I did have. And if I'm tracking what I ate for lunch, it's also data that exists too. So
Yeah. Yeah.
Amazing. Well, I don't know about you, Jeremy, but I'm like a little bit mind blown right now. And
Yeah.
I I'm like overwhelmed by what this app is capable of doing and how it can literally change people's lives.
And just the fact you can go from doctor to doctor and actually have all your
Yeah.
information available. Like
Yeah.
I don't know
yeah,
anything about healthcare, and even I know that's been a long-standing issue for people,
yeah,
especially for people with chronic problems who have to go to a lot of different doctors.
Yeah. Well,
And that what an amazing advancement that can be.
yeah, it really is. So, wow, I've learned a lot today. This has been exciting. So let's wrap this up on a high note because I'm like excited to literally tell everybody I know about this Guava Health app. Just PS. I hope to get you some new members or enrollees or clients or whatever term it is that you use.
I'm going to check it out, and I don't even go to the doctor.
nice. Perfect.
Yeah, exactly. But
Yeah.
yeah, I'm excited to share with everybody about this. But can you share before we say goodbye to you, where can we find you online, social media? You've touched on a few things already, but if you can kind of summarize that up here so everyone knows where to find you all and
Yeah.
get engaged with Guava.
Yeah, so you can find us online at guavahealth.com, and then you can find us on social media, both TikTok and Instagram, Guava Health and Guava Health Inc., depending on whether you're on TikTok or Instagram. But if you search Guava Health, we should be the first ones to pop up.
Awesome.
Nice. You got your good SEO too. That's smart. That's smart.
Yeah.
Easy to
Amazing.
find is good.
Always and easy to find. And you're active out there. So go follow Guava Health if you're interested in learning more about Guava Health and get enrolled in that app if particularly if you're listening and you have any kind of chronic health conditions.
And if you have to see a bunch of different doctors in succession,
Yeah,
yeah.
there you go. It's a perfect place to be. Well, Isabel, thank you so much. This has been absolutely like overwhelmingly exciting. I literally cannot wait to like shout this from the mountaintops, what you guys are doing. So we really appreciate you coming on and talking with us today.
Yeah, thank you so much for having me.
And there you have it, our interview with Isabel from Guava Health. Uh, cool stuff. What a great platform they're building there, bringing everything together in one place like that. But what are our main takeaways here, Heather?
I think really the biggest one is that the episode and just hearing from Isabel and what they're doing there at Guava um, is getting a full understanding, one, of the capabilities that they have and the solution that it is basically providing to a lot of big issues in the healthcare industry.
Yeah.
The Guava Health app really just it gives people um, what we've all been, I think, probably wanting for a long time. That access to information, that kind of bringing together of disparate data, and
Yeah.
that seems to be like a trend, I think, too. It's kind of a common thing that comes up in a lot of the interviews that we've been having.
And putting yourself in control of your medical information and
Yes,
being able to control its flow and control where it goes, who sees it, things like that.
right.
Like before this, like anyone not on that platform, as far as I know, like we've heard from people that they're getting like there's diagnoses in their charts that they were never even told about.
Yeah,
That's crazy.
it's pretty mind-blowing. And, particularly, the Guava app is definitely geared for people with, complex, complicated health conditions, comorbidities, things like that. Lots of doctors, lots of, medications, lots of therapies, et cetera. So, to have so many things, that they need to be thinking about to bring it together in one place it's a
Yeah.
game changer.
Yeah, really is. Brilliant stuff. Very glad we were able to get them on here in the earlier days. Maybe check back in with them in a while, see how it's going. One
Yeah.
might be worth a return trip a year from now, but
Yeah.
that's just me daydreaming. But all right, I guess that wraps it up for today. Before you go, please take a second to hit all those happy little fun buttons, whatever platform you're on, the likes and subscribes and shares. Auto download is a very good one for us on the audio platforms. If you want, or subscribe and on the YouTube if you're watching the video version. You can search us real easy on YouTube, find us there. We also have a Patreon with video versions of everything that you can support the Uprising more directly there. Patreon.com/healthcare uprising. And where else can they find us, Heather?
You can also find us online, healthcareuprising.com, and all the social media platforms like LinkedIn, Facebook, Instagram, and Blue Sky. Just search Healthcare Uprising Podcast, and you should find us out there pretty easily. Additionally, if you are a co-founder, a founder, an owner, anyone who's starting some kind of startup in the healthcare space, you are our people and we are yours. So we'd love to talk to you and bring you on the show and hear about what you're doing. So shoot us an email at healthcareuprising@gmail.com. Also, that applies to all of you humans out there who have your own personal healthcare journeys and stories that you maybe want to share with us. Also, give us a shout there at the email address and get in touch. You can also message us through any of the social media platforms too, if that's easier. As always, keep looking for the good in the world because sometimes it's where you least expect it.
This has been a Shut Up production.